And we are back inside the ladies' room for this beautiful Thursday, November 26th. Good morning again, everyone. It's so good of you to join us. Good morning, Andrea. Happy to have you here. And like I told you guys earlier, we have in our company this morning the Minister of Health, Honorable Nikolas Steele. And of course, like I said, we got a lot of information to disseminate. And if you've got questions, you can always pop it into the chat box so we can ask the minister if you're not clear on certain things. You just want a better understanding. We are more than happy to accommodate you this morning. All right. So without any further ado, let me say good morning to Honorable Steele. How are you this morning?
Good morning, Aruna, and good morning to all of your viewers and listeners out there. As always, a pleasure. It's been a busy couple of weeks since I was last on, but always, wherever possible, I find the time. I know we missed two opportunities in the past. I regret one of them was because of me, and another situations beyond our control. But I'm glad to be on today.
Totally understand. I know there's a lot happening and you're here, there, and everywhere. So whenever we can catch you, we definitely appreciate it. Now, of course, you would have had several, you would have made the rounds this week, press conference, a weekly press conference, and of course, had other programs where you would have, disseminated a lot of information. But it's important that we are clear on so many things with the upcoming holidays and, people wanting to travel and not sure what to do. So we're going to use this program this morning to be, to sort of highlight some of those, questions, frequently asked questions that a lot of folks are not too familiar with, and then we'll take it from there. Of course, if anyone has other questions they want to ask, you can do that. Now, where are we? How is it looking for us right now?
We still remain in a very good position. We have made significant sacrifices. We've taken significant measures, and they are paying off because they're science-based. Grenada remains one of the lowest ranked, and lower the ranking, the better in this case, of countries in the world and in the region. We are number 2 in the region, and we are in the low 48.
That's a big deal, right?
We are ranked the lowest ranking in terms of risk with CDC, with PAHO, with WHO, with CARFA. So all are recognizing the efforts. What we need to do ourselves is continue to recognize the efforts and the rationale for what we're doing.
And I think that's where the problem is. A lot of folks seem to not understand, and they have their own takeaways. So we're going to try as best as possible to clear those up this morning. Now, in reference to information, of course, I must commend the Ministry of Health. They have been doing a fantastic job in, keeping us updated. Every time I check the page, there's always new information, daily information. There's never a lack of information. It just keeps on coming. Sometimes for the day, 5, 6, 7 posts, So if folks want the information, they can definitely find it. But as I said, the holidays, Christmas is about family. It's about coming home, spending time with loved ones. And that seems to be a big deal right now for a lot of folks. In terms of before traveling, what is it folks need to know, and where can they find that information?
Well, the ministry, as you said, tries to disseminate as much information as possible. We address what we believe is pertinent bits of information, but also try to address where we see the new areas or different areas of concern or significant questions being asked. The underlying message remains the same since January, February. A significant amount of this, the majority of this, is science-based, but also a significant amount of it is information-based. And dealing with disinformation and misinformation as well has been one of the primary roles and tasks of this Ministry of Health in Grenada, as well as many ministries of health around the world.
Now, there's a lot of uncertainty. There's a lot of questions regarding before traveling. So someone who is in the US or Canada or wherever wanting to come home, what are the requirements specifically for those people?
Well, those individuals must apply to our website to receive an entry certificate. The information that they would be giving to us would be when they're coming home, where they're staying, do they have any symptoms of COVID, etc. Basic health questions, as well as confirmation that they have made the arrangements for their quarantine. There's also the ability, should someone need to or think they qualify for home quarantine to also do that as well. It also allows the individual, once they have that PCR test, to upload it to us for verification. But the PCR test is needed for check-in and boarding. So we do understand now, in moving to the 72-hour, that individuals may not have that PCR test result in hand when they are applying for the entry certificate, and we've made the accommodation for that. There are two documents that must be presented to any airline check-in counter for check-in and boarding. One is the entry certificate, and the other is the PCR test result, negative PCR test result.
You must have those.
Must have both, but it doesn't mean that you must have the PCR test result before you apply for the entry certificate. We have
Okay.
allowed for a verification process, but it's not absolute, because we do understand some people won't get their results till down to the wire. So we've made the accommodation for that. The other
Okay.
difficulty, I think, for most individuals abroad is how to get a PCR test
Within
result
two.
in the 72-hour window now.
Yeah.
And we've tried as best as possible through our consulates, and I encourage individuals to please contact our consulates in London, in New York, in Toronto, in Washington, in Miami, for information to be shared as best as possible. Now, that is the information that we have compiled as best as possible to assist individuals. We're going that extra distance of telling them where they can get tests in their own country, not our country,
Okay.
in their own country where they are residing or so. But there are still challenges. Now, this new criteria is not meant to create hardship. While we do recognize that it has created some hardship, it is to reduce our exposure here in Grenada. It is recognizing that if someone has only 3 days between testing negative and traveling, their risk of being infected before they came here is significantly reduced. And this came out of recommendations by CARPHA, Pan American Health Organization, and WHO. You want to reduce a person's time of exposure if they are coming from an area where there is community spread.
Got you.
That's the ultimate goal of this. Travel right now throughout the world is difficult, and we are just trying to make sure that we keep our country safe.
I think that seems to be the general concern, because I've gotten a lot of messages from folks asking, well, where do we, there with so many new cases and so many people getting tested now in certain areas, it's literally, sometimes it requires almost a week, the 7-day window that we had before. But what you found is that when folks did it within that 7 day, they're going about their business as normal, doing whatever. And while it might
Yes.
be negative, by the time they get here, it's a positive, because people think, okay, paper in hand, I'm negative, so I can go about, I can hang out, I can do whatever, because this test here says negative, so that'll be okay. You mentioned spoke a lot about personal responsibility the
Yeah.
past couple of days, and I want to give you the opportunity to speak a little bit more on that, because there seems to be a lot of pressure on the Ministry of Health to do everything. But what about the personal responsibility of everyone?
Yes, there is a lot of pressure on the Ministry of Health, but we do believe that, as we've said from the beginning, we're all in this together. Ministry of Health has set guidelines, scientifically proven guidelines, for us to protect ourselves and each other. Ministry of Health has now found itself in a position where we have to enforce those guidelines to protect all of us, because some people are not taking it seriously. Some people blatantly, and some people out of a misunderstanding or so, are not taking those guidelines or ignoring those scientific guidelines. And it's a unique position we found ourselves in, but we have to deal with it because we have the mandate to protect the nation as best as possible. So it's been difficult, but you will see that we try to present information, as much information as possible, to the public. We've been saying the same things over and over and over and over again, but we also now have to be involved in enforcement of this, because while we are a democracy, one may say, well, people are free to do as they wish, but not in the case of an infectious disease. You putting others at risk means that you are breaching these regulations, and I don't believe, nor do the majority of us believe that personal rights allows you to endanger others. Personal rights come with the responsibility of making sure that they don't come at the detriment of others.
Got you. Now, in terms of course, folks traveling to Grenada, coming from what we term a low risk country, are they also required to get tested before traveling?
We are requiring the testing and quarantine across the board.
Mhm.
Quarantine and testing across the board for any individuals coming into Grenada, because in 90% of the cases, getting to Grenada means that you are interacting with, sitting on a flight with, or
Mhm.
passing through countries that have community spread. And as such, travel on the whole is risky. Travel itself right now, regional or international travel, is a risky activity. And as such, there's a requirement for pre-travel testing, and there's a requirement for quarantine post-travel.
So I want to go back a little bit to the testing because I'm seeing a couple of questions in here. Um, Another person says it's impossible to receive a 72-hour test in 72 hours in Canada. We conduct thousands of tests per day, so that definitely puts us at a disadvantage.
Well, I would say that Barbados has had, and other Caribbean islands have had, the 72-hour requirement in effect and in force for almost a month or more. So it is possible. Difficult, I'll agree with people. Very
Mhm.
difficult and stressful. And I do acknowledge that, and we apologize for that, that it is difficult and stressful. But it is possible, and that's why we have gotten information, and the information is available through our consulates as to where one can get a test within the 72-hour period.
So again,
May not be, I'll be honest, it may not be the same for every province in Canada,
mhm,
but that is not an excuse from our side to be more lax with our safety here. The tables have turned, where in the past it was the first world nations that were saying to us developing countries, you're putting us at risk with
yes, mhm,
pandemics because you don't have a strong enough system. We have made the significant investments, etc., per population. Yes, we have a smaller population, but we have ensured that individuals can get testing, and our entire population, those who need access to it, can have access to it. And we do understand the different difficulties, and it's a whole different situation when you're talking of hundreds of millions of people as opposed to 100,000. But we still do have to put the measures in place to protect our borders. And like I say, I do understand that it is difficult and extremely stressful for individuals to now comply with the 72 hours. My heart goes out to you, and I do understand that.
but we have to
The
look at the bigger
objective
picture.
here is to protect our beloved country.
Someone here is also asking, since all cases are imported, why are we still prisoners in our own country wearing masks to guard against what? Why not beef up the security at the facilities? And then
Well,
talk about facilities after.
ask any St. Lucian. St. Lucia is infected, not because of lack of security at the facilities.
Hmm.
St. Lucia is infected because, as we have said from day one, the risk of somebody smuggling themselves in. Now, that bus driver, who was the first, as far as we are aware, the first St. Lucian to be infected by that person who smuggled in, was or smuggled himself in. If that bus driver was wearing his mask and practicing what the St. Lucian government had said, which is the same thing we are saying, that bus driver would not be infected. So it's not to make you prisoners. It is for us to take the required safety measures. We take other safety measures in our daily life before COVID. We lock our doors. We close our windows. We avoid mosquitoes. We don't let rats come around. So we take certain safety procedures to,
Hmm.
to protect us. For the time being, while there is a pandemic, there are additional measures that we must take to keep ourselves protected. It is not meant to restrict personal freedoms. It is meant to ensure that we can continue to enjoy as many personal freedoms as possible for as long as possible. If a significant number of us are dead from this virus, there's no question of personal freedoms and personal liberties. So we are asking the population and expecting the population to comply with some restrictions in order for the majority of us, or all of us as best as possible, to get past this. And once more, again, enjoy the lifestyles that we crave and we look forward to getting back to. But between now and then, there is going to be some sacrifice.
Now, this week, of course, in the news, we heard of two gentlemen coming in via a yacht and being intercepted by the employees at a particular spot, and so and of course we're talking security and everything. Now that is also a one way of the virus getting here. We not know about if we're vigilant. So speak on the different ports of entry and what are the protocols there regarding yachts and folks on those.
There are for private vessels, there are two ports of entry for the state of Grenada.
Hmm.
That is St. George's at Yacht Club and in Tyrrell Bay for Carriacou. Those are the ports of entry for private vessels. This information has been put out far and wide. However, as we saw this week, individuals did not receive this information. All of our investigations showed that these individuals had no intention of smuggling themselves.
Okay.
They came into a port that normally pre-COVID would have been a port that they could have cleared at.
Hmm.
Probably were looking at paper maps or old information, not the most current information with respect to COVID.
Hmm.
And as soon as they arrived at the port, as soon as they came alongside the jetty, they said, "Where can I clear? We've come here to clear."
Okay.
And they were informed, "No, you cannot clear here based on COVID measures now. There's only one port. Please go to that port." They were in the process of going there immediately when their vessel ran aground and needed assistance. So I don't think in this instance, these people had any bad intentions.
Sure.
They had information. And we have to assume that will happen. There were language barriers. In this case, they came from South America, etc. But this is also to be used as you were alluding to, an example of even people who are trying to be compliant
Hmm.
can make a mistake and infect us inadvertently. These individuals had no intention of infecting the individuals or putting the individuals at risk who are in quarantine now. They had absolutely no intention.
That's
They
good
made
to know.
a genuine mistake. They came in and then needed assistance. And because of our humanitarian response and obligation with respect to Coast Guard, and so they went and rendered assistance to them, put themselves at risk,
Hmm.
and are now in quarantine.
Okay, great. Of course, this is important to ask questions because what we're circulating was something totally different. Like, they sneaked in and was trying to
Yeah.
get on the island. And I had a couple of these questions prior to this interview, and home quarantine. Of course, a lot of the rules that have changed regarding that. Speak to us on that and as to how folks can apply for home quarantine and how can what other additional information they need and where can they get that information from.
Yes, home quarantine, the new measures are put in place because, like everything else, and one of the individuals previously who asked questions about just strengthening the facilities, putting extra security or taking extra measures, home quarantine is technically a facility as well. It's individual facilities. And what we recognized very early in the process is that there were too many applications for us to monitor properly. They were too far up around the island. We did not have enough personnel to monitor and to the best of our abilities, where we would feel comfortable that the situation was being observed and policed properly. So we had to set some criteria in order to reduce the number of home quarantine and recognize that there's certain people that really did need to be in home quarantine because of certain conditions, etc. And so, and that's why we said for home quarantine, there's a pre-screening. You must meet one of the following conditions, which is that you must 65 or over, or a member of your travel party must be 65 or over, who will be quarantining together. You must be traveling with young children or minors in your party, or you have a medical condition, a relevant medical condition, or disability that necessitates that you should be in the comfort of your own home, or there's certain things that are within your own home accommodation that will keep you safe or more comfortable. And then whether if you are a diplomat or government official, because by Geneva Convention we must allow that. And we still said extenuating circumstances, which would be something we may not have thought of, but that would allow us to give that additional consideration.
Mm-hmm.
So those are the criteria that must be met. One of those, at least one of those. Now there are individuals that meet more than one of those, and most definitely we accommodate them with home quarantine. Now, after that pre-screening, then our health wardens and travel desk will inspect the location, the home,
Mm-hmm.
to make sure that, further to that, that the home itself meets the criteria, that no one else is living there, that there isn't a common entrance shared by other individuals, or common facility shared by other individuals who are here who would not be in quarantine, etc. Those are some of the additional criteria. Once all of that is met, then there is approval.
Okay. Now I want to speak on the watch, the tracking app and what have you. I'm not sure if you're aware or if there's anything that we can do about it, because I've been in contact with family members who had those watches and they was not working properly at all. Out of three or four, probably one. And it wasn't something. It was just on their hands, and it was just like, you know a piece of jewelry.
Right.
What are we doing to fix that? And of course, those who are responsible for monitoring it and ensure that it works, for those home quarantine doing the home quarantine, what are the steps we're looking to take to ensure that they do what they're supposed to do?
But Aruna, we have purchased additional devices. In fact, if you give me 2 seconds, I'll get one of them and show it to
Okay,
you.
got you. See, you can do anything when you're in life. Good morning, everybody. Just tuning in. Of course, don't forget it's the ladies' room, compliments, Beacon Insurance, and Western Union. And we are speaking with the Honorable Nikolas Steele. You're back? Okay.
There we go. Yes. Now, what we had previously was an actual GPS watch that looks very similar to a normal wristwatch,
Mm-hmm.
like a battery operated wristwatch.
Okay.
We found that those most definitely were not functioning properly. We had rushed, or with the service provider, had rushed to come up with a solution earlier. And we found, and this same thing was found in other islands as well, that the initial solution was not functioning the way we wanted it to function. So we had collective discussions, that's us, Jamaica, and St. Lucia, on an appropriate device from the lessons that we had learned and the failures agreed across the board, the failures of the first set of devices that we had brought in. So we have collectively purchased or procured new devices, and the devices are intended to make the experience more comfortable as well, but also to ensure that we have that level of monitoring. So this is the combination of the devices.
Mm-hmm.
So this is kept in the pocket or on the table, desk, bedside, in the room that you're at any point in time.
So every time you move with it.
Yes, you move with it.
Okay.
This is the GPS locator. This has the SIM card in it, and this is what's communicating to us to let us know where it is, this device.
Okay.
This is placed on your arm. Now it looks like the single-use plastic devices that are put for parties, etc. And so,
Mhm.
but it has this hard piece of plastic here,
Yeah, so what
which
does
is
that?
this must be within 20 feet of this.
Can
If
someone
this,
check on
if the two are separated, we get an alarm. If
that?
this moves from the location it's supposed to be at, we get an alarm.
Oh, great.
So these two must be in combination. So the person only wears this. This can be plugged in and charged. The person only wears this white band, and it's a single use. Once you put it on, we have to remove it. And when we clear you from quarantine, we'll come to remove it to ensure that you have been compliant. But the two must be together. This allows us to communicate to you and speak to you and ensure that you remain in the location that you're at. So these are the two devices that Grenada, St. Lucia, and Jamaica are now implementing for use throughout for individuals who are in quarantine.
Is it for general quarantine or for home?
It's for home quarantine, and what we have done as well. The ministry is in the process of discussing with some of our smaller facilities, 2 bedroom, 3 bedroom guest houses, etc., that meet most, if not all, of the criteria, except the ability to have security 24/7 at their facility.
Okay.
And I recognize that it may be impractical, financially in particular, for some of these smaller places that want to participate and will get everything else right, for them to have to pay for a 24-hour security guard. So for those facilities, they would be using the device as well. And what we have done is we have made the device for the period of rental. It's going to be approximately 11 US dollars per day that they have to add on. And it's only for a fixed amount of days. Even if the person stays longer in quarantine, we don't charge extra. So what it works out to be is 150 EC dollars for the entire period of quarantine
Okay.
that these facilities would add on to their charge, which is much more affordable than them having to pay for a security guard full-time 24/7. And also individuals in home quarantine would also be asked to pay that rental fee for the device in order to ensure that they remain in quarantine, and for us to have the level of due diligence as best as possible to ensure that they remain in quarantine. So we've made it much more affordable. We've consistently, in our efforts to make sure that they're more effective, in fact, that they're working, also made sure that they are affordable as well.
The cost of it is $150, you said, and
The
$11.
rental fee, 150 EC dollars for the entire 5 or 6 day period that persons are in quarantine.
And the 11 US is for.
It's the same, 11 US a day
Okay,
or 150 EC. Just say converted into EC dollars for the entire period,
got you now.
150 EC dollars.
Alrighty. Okay, so upon arrival, though, we sort of jumped the gun and went on to the devices. But upon arrival at the Maurice Bishop International Airport, what is expected from the travelers?
Okay, individuals upon arrival now would have their entry certificate, which they would have gotten even before check-in, before departure, and they would have their PCR test results, both of which can be electronic or paper.
Okay.
The entry certificate being issued is barcoded, has a barcode and QR code. So our health officials now don't have to be exchanging paper with individuals at the airport, nor do our immigration or customs, because part of the process in applying for the entry certificate, you also fill out your customs declaration, immigration declaration as well.
Okay.
Immigration and customs scan the QR code, and all of your information is pulled up so that they can clear you through. Same with us for health. We will screen you, ask certain questions, check your temperature, ask you if since filling out the entry certificate, whether you have been in touch with anybody that has COVID-19, whether you've been to institutions that treat people, whether you have a fever, any of the symptoms, etc. And also asking you additional questions with respect to vaccinations for other diseases, just general port health questions, and confirming your quarantine location or option. At that point, the armband would be put on you if you are home quarantine or one of the smaller facilities. And if you haven't paid for it in advance, that you would be requested to pay at that point. You would then go through immigration and customs for them to do their required clearance, and then would leave the airport with official transportation, officially approved transportation to your quarantine site, whether it is home or one of the approved quarantine sites. That, in essence, is the process on arrival. Now, when you are given health clearance, you will right now still be given one document to sign, which is your quarantine order, which spells out for you that you sign and agree to the terms and conditions of quarantine. Now, we've always had that. There was discussion that should be paperless as well. I would like for that to be paperless, but we think right now, based on the legal implications of that document,
You want to have it
that
signed.
document you will be signing to it, although you receive a copy of that document as well before you come to Grenada. As part of the entry certificate, you receive that and your quarantine document. But you will sign to that document and receive a copy of it, either electronic or hard copy of it at the airport.
Now, if you're approved for home quarantine, do you have to take another PCR test?
If you are approved for home quarantine, you have to take a PCR. You will be swabbed for a PCR test at the airport.
Okay.
Rationale being that we do recognize that we don't have as much control over individuals in home quarantine as we do at facilities. And as such, we want to reduce the risk. So we want to find out most definitely whether you have come in infected or not, or if we can test by then. But we do know that on day 4 is the final one, once we remain in quarantine, that we can determine whether you are infected or not. There are discussions right now, but a decision has not been made on it as to whether, because we've brought it to the 72-hour now, whether you still need to have that test on arrival. But that is science-based, not a matter of economics or logistics. And if and when I have a decision on that, we will make take the appropriate action on it.
In terms of children, what are the requirements for children? Are they required to undergo PCR testing as well?
Children under 5 are not required to undergo PCR testing for travel purposes.
Okay.
If there is a family that is infected, there may be the need from an epidemiological standpoint also to find out if children are infected or not. But for travel purposes and a travel screening, children under 5 or 5 and under are not required to be tested, PCR tested.
In terms of costing, somebody was asking for a breakdown of all the costs once you land on island. Are you required to pay for all the tests? How many are those? And
you will be required as we move forward to pay for the test and the device if you are required to have the device. So I think in general, everyone coming in can expect as we move forward to pay for that test. And depending on your choice of quarantine location, you would be required to pay for the rental of a device. Now, that's outside of the usual, you have to pay for the transportation to and from the airport if you are coming for a short space of time or so.
Okay. I'm happy you mentioned transportation because that's another one thing someone brought to my attention, someone who came in. They were talking about the close proximity of the passenger and the driver and not seeing like what we call it, the plexiglass thingy, the separation or sort of. And they voiced a concern about how close they are, and if that's something that the Ministry of Health will be talking about or have some conversation with taxi drivers regarding.
We have done training with the taxi drivers. They were one of the first groups to make sure that they follow the protocols to reduce or to minimize their risk of exposure, and we consistently monitor them as well to make sure that they consistently follow it. Now, you can go to the level of making sure that the rear of the vehicle is completely isolated from the front, with as the person had suggested, with plexiglass, etc. And so, but we do believe if the other steps are taken with respect to sanitizing the vehicle, wearing the proper masks,
Mhm.
practicing hand sanitizing themselves, and not having physical interaction with the individual, is that we greatly reduce the risk. But there is still a risk. And that is why you'll find some of these individuals who are providing this service as well may not be charging their regular rates, but we are monitoring to make sure that it's not too exorbitant. But it is a rate nonetheless that takes into consideration the risk that they are putting themselves in by providing this service.
Alrighty. So, someone probably just joined. They're asking again, what's the cost of the PCR test?
The PCR test is approximately $410 EC for the PCR test.
And you have to pay for each test?
Just the one.
Just one. Okay.
Yeah.
So, what happens between that time? Someone's a friend, no, friends and family can't pick you up. I can answer that one. So what happens between the time you're in quarantine? Because remember previously, well, of course, on the onset of COVID, we had this 14 day, and then we cut that down a bit. And folks seem to think that, okay, they say 4 days, I'm supposed to leave on the fourth day. We had some issues with that because,
Yes.
so just to clear that up a bit, what happens within that time that you're in quarantine, and what are you supposed to do?
Yeah. Individuals, please take note that on arrival, and it hasn't changed, on arrival, you are signing a quarantine document that says 14 days. It does say that you are going to be in quarantine for 14 days. We do explain to individuals that, and the legislation recently passed confirms that you will spend up to 7 of those 14 days in complete isolation from other individuals. That is what you will spend up to 7 days. And you cannot leave that isolation until you are cleared. We will swab you. We will come to you on the fourth day and take a sample to be tested. As soon as those test results are available, whether it is day 4, day 5, or day 6, and they're negative, you will be communicated to, and that will allow you to clear quarantine, the isolation period of quarantine. And you're still asked to monitor yourself for the rest of the 14-day period. Report to us if you have any fever, etc. Try as best as possible to minimize your social interactions, and also comply with our rules and regulations of wearing the mask and physical distancing.
Great. Getting ready to wrap up shortly, but are all these information available? Where can folks find
Yes,
information?
they are available on the ministry's website, which is COVID-19, not COVID-19, covid19.gov.gd.
Mhm.
From that location, covid19.gov.gd, you can gain access to the application process for entry. You will have all of the protocols listed. Now entry protocols listed as they change because the situation changes consistently, and any other relevant information from the Ministry of Health with respect to COVID and the Ministry of Health in general.
So, for the benefit of those just joining us, you guys can always look at the live again. Just to give us a little bit more, probably just to wrap up, during their stay in Grenada, just a general roundup. What are they required to do undergo during their stay involving quarantine and everything?
But first off, before you travel, you are to apply for an entry certificate.
Mhm.
That can be done way in advance, or it can be done closer to, or it can be done in part, because as you get closer to your travel date, you'll have more and more information.
So,
But the entry certificate in particular is going to request that you prove that you have made quarantine arrangements. It allows you, if you are requesting home quarantine, to go through that pre-screening process, and if you pass that pre-screening process, to then be notified of that, as well as the final approval for your quarantine, be it at home or at an institution. You also have to have a PCR test, but you don't need the two. You don't need the PCR test in order to begin the application process. You need both in order to check in and board a flight and also when you get here in Grenada. You need both, either printed or electronically, to check in and board a flight, as well as to arrive here in Grenada. When you arrive in Grenada, you are going to go through health screening, verification of your quarantine accommodations, etc., and will, depending on your choice of quarantine location, you will receive one of the armbands and GPS devices, depending on your choice of quarantine location or choice of quarantine. You then go through immigration and customs. You are then transported by approved transportation to whichever facility or location you have been cleared to go to. You will spend your time there up to 7 days there. On the fourth day, we will come to your location and take a sample for testing. When those results are back after the fourth day, which can take 1 or 2 days at least, you will then be communicated to by health officials at the travel desk that if your results are negative, that you are cleared quarantine and are free to leave the isolation facility that you have been in. You are still asked to monitor yourself with respect to temperature or so for the remainder of the 14-day period. If you do test positive, you will remain in isolation quarantine. Depending on the location or your condition, you may be asked to relocate to a different facility. That is the criteria with respect to entering Grenada or coming back home or returning to Grenada.
Okay. Alrighty, I think we would have covered a lot. And again, folks, if you would have missed the start, you can always look at it again, and you can also check the website. One final question: folks are saying they're seeing conflicting information on the sites. So we want to make sure that everything you're saying is what's there, so people can check it out.
Well, it's designed by human beings. We've spent a lot of time designing it, but if something appears to be conflicting or is conflicting or appears to be confusing, please let us know so that we can correct or we can clarify. It's a mechanism that I've seen happening actually before, and I'm returning to a Caribbean health ministers, CARICOM health ministers meeting after this. Those are the type of discussions that are being had throughout all of the CARICOM countries, in terms of making sure that the information is as clear as possible, always recognizing that some people may misinterpret, or because we haven't gone the extra distance with clarity or the use of the language, that it's subject to interpretation. And as such, we strive to always correct, improve the way the information is communicated, whether it is the wording pictorially or however possible, to make sure that the message we intend to get out there is the message that's received.
Okay. Final question, and you can wrap up on that one. Folks are asking, where are the approved places listed?
The approved places are listed on the Ministry of Health website and on the application process too. You can only select approved places in the application process, and the approved places are listed on the Ministry of Health website as well. Bear in mind that daily this list changes.
So you always have
new places that are coming on, and also there are current places based on shortfalls or shortcomings or so, or at their own request are being removed.
So basically, if you're making plans to travel, you just need to check every time to make that.
I think with the same with your airline as well.
Mm-hmm.
We are very much aware that airlines as well, you have to keep checking, because some flights are being canceled, postponed, etc., be it because of country policies or airline policies. So travel is very difficult and stressful during this pandemic. But remember, what we have done is move from no travel to try and accommodate as best as possible. But in no way have we implied or do we believe that such a travel during a pandemic would be stress-free.
Understand. Final word before we go?
Just to say that again, we're approaching the Christmas season. It's Christmas for us all. And I think we need to, as always, be our neighbors' keepers. We also got to recognize that some of the traditions, what have become age-old traditions for us, that every year we do this, every year we go here, every year we have this fete, every year we have dinner or lunch by auntie or by uncle or by grandparents or
Bringing
by
in the New Year's and all those things.
this year we are going to have to reconsider all of that. I heard this morning it was best put by President-elect Biden, because the U.S. they're going through their Thanksgiving now, and he said, that this year he has made a decision, and many individuals, responsible individuals, have made that decision because of love of family, because of the closeness of family, because of the value of the tradition we have with spending time with family and friends, that we choose this year not to do it, so that we will be able to do it with all of our family and not put them at risk next year.
I
And
like
I think the stronger the family bonds, the longer the tradition of doing these things, the more we should find that as encouragement to say not this year, so that the tradition can continue longer and we can all have health and as many of our family and friends together next year.
all you got to do is put on the television over 200,000 plus people.
Yes. And Aruna, look, in the past, before COVID, we would have been meeting face to face in the studio.
Mhm.
You have had to make that adjustments. In making that adjustments, most definitely the show isn't the same. The interaction isn't the same, but it is what we have to do in order to carry on. And we look forward to when we can have the in-person, in-studio connections as soon as possible. But when we get to that,
Yeah.
we will do that. Between now and then, we have to make certain sacrifices and adjustments.
Totally. Minister, thank you so much for taking time out to finally check in with us today. Appreciate it. And of course, you can check us again anytime. You can come in at anytime. We'd appreciate you a whole lot. Thanks so much.
Thank you, Aruna, and as always, stay safe and stay out of trouble.
Always. Thanks so much. And that is our ladies' room for this week. And of course, this morning, catch us again next week, God's will. And of course, we'll be back for another one. All right. So until then, stay powered up. We got your entertainment news coming right up. Happy Thursday, all.